Stomach polyps are also called gastric polyps. Polyps are masses of cells that form on the lining inside the stomach. Stomach polyps are most often discovered when the doctor is examining the stomach for some other reason. Most stomach polyps don't become cancerous, but certain types can increase the risk of stomach cancer in the future. Depending on the type of stomach polyp you have, treatment might involve removing the polyp or monitoring it for changes. Symptoms. Stomach polyps usually don't cause signs or symptoms. Sometimes they may cause pain or tenderness when you press your abdomen, nausea, blood in stool, anemia. Cause. Stomach polyps form in response to damage to your stomach lining. The most common causes of stomach polyps are gastritis. This condition can cause the formation of hyperplastic polyps. Familial adenomatous polyposis. This rare, inherited syndrome causes fundic gland polyps. They can become cancerous. Familial adenomatous polyposis can also cause adenomas. Regular intake of proton pump inhibitors to reduce stomach acid can also cause polyps. They are usually not cancerous. A small polyp is identified in antrum of the stomach. Another small polyp in fundus of the stomach. Multiple biopsies are taken from polyp to identify the nature of the polyp. A small hiatal hernia is seen. A small polyp is identified in distal body of the stomach. No other polyps identified on retroflexed view. Multiple biopsies taken from polyp. A biopsy is also taken from antrum for H. pylori testing. A small polyp identified in gastric antrum. Lax lower esophageal sphincter is seen on retroflexed view. Multiple biopsies will be taken from the polyp. The entire stomach is studded with very small polyps. Biopsy from antrum of stomach. Multiple biopsies were taken from the stomach. Multiple gastric polyps, visualized in body of stomach. Multiple biopsies taken from the polyps. Diagnosis. Upper GI endoscopy and biopsy is performed to identify the nature of the polyp. Treatment depends on the type of stomach polyps. Small hyperplastic polyps does not require removal. Large polyps or polyps that are adenomatous require removal. Your doctor may advise you to stop intake of certain medicines. Your doctor might recommend periodic monitoring, so that growing polyps that cause signs and symptoms can be removed. Infection by H. pylori bacteria will be treated to prevent hyperplastic polyps from appearing in the future.